all hooked up for today.
And yep, this is my wife with this freaking game she loves so much. And this is her husband making a blog for her this time. She's playing Theme Hospital. She had it on an old desktop, like Windows 98 version. And now we've got it on a brand new spanking Windows 10. And she's gonna be an addict again. Thank you, thank you, thank you.
Good morning, everyone. Actually, it's like 4 something in the morning, and I have not gone to sleep yet. So, I wanted to go ahead and do my vlog for today. The vlog that I'm doing this on is dehydration. You know, there's a lot of people that do not understand the different dehydrations and why in some people they can just drink and drink and eventually get rehydrated. For others, they're not so lucky. I even go to the point of urinating one time, I'm good. Next time, I'm having a little bit of stinging. Another time, yeah, I have a lot of pain and nothing else coming out. And used to it had me running to the hospital or doctor's office to see if I have a urinary tract infection. So my dehydration gets really bad. And so the majority of the time, dehydration comes from everybody and anybody with fevers, vomiting and diarrhea. You know, that comes with just a stomach flu. You know, medications can cause an increased dehydration because some antibiotics increase diarrhea. And that's just a common side effect. Minor illnesses such as infections affecting the lungs or bladder can result in dehydration in the elderly, but you know, just because it says in the elderly doesn't necessarily mean that it is just in that group. It can be in anybody. I have that problem, but then my body no longer works the way it did. I've had so many things removed out of me that my body just doesn't work right anymore. So, mild to moderate dehydration can be reversed by drinking more fluids. I had no problem drinking. I can drink and drink and drink and drink, but I also have gastroparesis, which is a paralyzed stomach, basically. My stomach, after eating, after the course of 4 hours, I still hold 82% of my food in my stomach. Usually, I still see food coming out that I ate 2 days ago. I'm not a big eater, and since I have the ileostomy, I see exactly what it is that's coming out of my ostomy bag. And right now I've got some air in it. I no longer have my large intestine. That was removed completely in 2014. But before that, I still had problems staying hydrated. I was actually being admitted a lot for being dehydrated. So in 2014, I asked to keep my port in, keep it accessed. I had home health still. I was keeping home health. I had them for like 2 years straight. And my IV fluids. Bad weather came around. My nurses weren't able to get to me. I started taking care of my own port. Well, and I was doing my own fluids anyway. But I started taking care of my own port. And that just kind of went down. And I got rid of home health. But me going and keeping the IV fluids have kept me out of the hospital. Had I not went to IV fluids at home, I would be in and out of the hospital a whole lot more. So, some of the causes that cause dehydration. Diarrhea, vomiting, severe acute diarrhea. That is diarrhea that comes on suddenly and violently. Can cause a tremendous loss of water and electrolytes in a short amount of time. And because I have the ileostomy, this thing is going all the time. I'm talking to you right now, and I'm pooping. Okay? It's liquid. Sometimes I think that it's behaving, and I need to change it, and I will take it off. Next thing I know is boing, and it's hitting off the wall. So it's always really, really, really loose. It's just pure liquid. And then, like, I might see spaghetti noodles or whatever, but anyway, yeah, it can cause me to lose water and electrolytes in a very short amount of time. And if you have vomiting that goes along with the diarrhea, you lose even more fluids and minerals. And I don't think that I've had any vomiting with Crohn's. I've had the vomiting with the gastroparesis. And so that is where I get my vomiting from. The diarrhea, it goes hand in hand with the gastroparesis and the Crohn's disease and the ileostomy. So, yeah, my body just doesn't work like everybody else's, and some people seem to think that, it does, and you know what, it doesn't, and so they want to think that they know more about my body than I do. And if you have excessive sweating, you lose water when you sweat, and vigorous activities and all that makes you hot and dehydrated and all that. I don't have that problem. I don't sweat. So, I mean, if I sweat, I must be doing a whole lot, because on a normal basis, I don't sweat. So, increased urination might be due to undiagnosed or uncontrolled diabetes, certain medications, diuretics, blood pressures, can all lead to dehydration, and they can make you urinate more. Even if I take a diuretic because I'm bloated, I still don't urinate that much. And because I have 2 GI diseases, I have a lot of diarrhea. And, of course, that makes me lose a whole lot of fluids and electrolytes. And if they are not replaced, it causes dehydration. And most people can have theirs replaced by water, Powerade, vitamin water, Gatorade, any of that. But for me, I have persistent diarrhea, and it is challenging to maintain water electrolyte balance. And with gastroparesis, it doesn't matter what I take, what I do, it sits in my stomach. My stomach has something like a heart pacemaker. It's zapping my stomach, trying to make the stomach muscles move, but it's not always working. It's just kind of there, and I question if it works, because if I still have food coming out 2 days after I have eaten it, it's an iffy thing there. And so it also hinders vitamins, my medications from being absorbed. And that is why I choose not to take oral Phenergan, and I don't have oral Zofran, but that's why I choose not to take the oral Phenergan, because it doesn't help. It's just sitting in my stomach. It's not being absorbed. It's not moving anywhere. My small intestine's job is not to absorb anything. So I'm screwed in that area. So with gastroparesis, everything just moves to the stomach and sits there. And what moves is not absorbed, as it's not the job of the small intestines. More serious dehydration, moderate rather than mild, includes dizziness, muscle cramps, pale and dry skin. I can go back and look at myself in some of my older vlogs, and I can see the looks around my eyes and whatever, and yeah, I can see it. And muscle cramps, pale and dry skin, nausea, vomiting, and sunken eyes. I never have moist skin, never. I'll be playing on my laptop, and I'll not have any moisture in my fingers. I'm always doing this, trying to move the mouse, get the mouse to go on the laptop. Otherwise, it's just, I'm just touching. I mean, there is absolutely nothing. I never have moisture. Never any moisture. I use lotion all the time. There's lotion over here on my table all the time. Lots of lotion. When I take my shower, I use Aveeno oatmeal body wash, and then I don't dry myself off after I rinse myself. I use Johnson & Johnson baby oil. Then I use Nivea lotion for very dry skin. And if I miss any of that, I pay for it, because I start just itching like crazy. So I have to keep up with this regimen that I do. And it takes me a while, just before I can even get in the shower. If it's time for me to change my needle, then I'll just go on, I'll flush it, and I'll take it out, and I'll take a shower. I'll look and see, like, I just changed my whole ensemble down here on my bag. I did that today. So tomorrow it won't need it, but I might uncover it and let the shower hit it. But usually it is a 45-minute, an hour and a half to 45 minutes to hour and a half to an hour and 45 minutes to do my whole thing, to take a shower, get dried off, do everything all over again. And it is so time consuming, and it is so wearing, and so it wears me out. And there's people that wants to say what they think they know I go through, and what other people like me go through, and that I'm not really going through this, and that my life isn't like this, and I'm playing the poor pity me card, and I'm not as bad off as I'm saying I am. But just to let this be clear, everything that I have said is wrong with me is true. Why would anybody in the right mind want anything else wrong with them is beyond me. I have never figured that out. It's really bad when you have people who think that your vlogs is about them, or you're in a competition with them, when in fact that you could really care less about their issues and what they say their illnesses are, because they're constantly going back and forth from different doctors and trying to get a new diagnosis, and questioning my dehydration, and and stuff, and then getting pissed off over another vlog that I have already done, and this is just gonna be a whirlwind thing, and there's never gonna be anything, and I am trying to spread awareness about invisible diseases, invisible handicaps, illnesses, and with having severe dehydration, and the Crohn's disease, and the gastroparesis, and my blood disorder, and I have a list of things wrong with me. Yes, I can go get a handicap license placard. But the thing is this: I don't use a handicap parking spot. I just made that because we are still not accepted in the handicap community. Because for one, yeah, I'm sorry you are in a wheelchair, but some people that are in a wheelchair has just as much energy and motivation as other people, and you have other people that cannot walk, or is so weak that day, and they have a handicap placard. They're gonna park there, but they're still gonna get the stares, the dirty looks, the the mean people talking to them, the notes on the cars. And so, you know, when somebody says, well, just because you have had a bad day or feel bad, still does not justify you parking in a handicapped space. The others are for people who can barely walk and actually have serious medical problems. You dehydrated, drink more, and don't go out that day. It should be common sense. Well, you know, sometimes you have to go out. And, you know, if I had to go to the doctor that day, well, then guess what? And I have a handicap placard, and I don't feel good, and I'm sick, and I'm barely moving, I'm going to use that parking spot. Sorry, get over it. You're gonna have to be accepting. It's just, you know, people just think, well, that's not all of them, though. I mean, there's just, I think I've just got this one because she's just being a little bitch. And one of these days she's gonna come across the wrong person, and it's not gonna be all fun and games anymore. Because this isn't the 1980s. So, I'm on IV hydration, and I have been since 2014. And had I not started in 2014, I would be in the hospital a lot just to get rehydrated. So it has saved me a lot of hospitalization time. So the way the IV hydration therapy works is by delivering the hydration and essential nutrients that my body craves directly into my bloodstream. It's bypassing the digestive system, which means I'll feel more the effect of the fluids, electrolytes, and vitamins more quickly and benefit from 100% absorption. There are many benefits to IV therapy, including 100% absorption into the bloodstream, fastest way to restore optimum hydration, prevent illness, improves overall brain function, fuel and support the immune system, healthy balance of essential vitamins, renewed energy, and clears toxins. And this is what I've been trying to explain to some people. When you drink fluids, it goes through your digestive tract. My digestive tract is fucked up. But when I get it through my veins, I get it to where I need it to be. And so that's why when I'm out somewhere, if I'm out at a family reunion, you know, I can get dehydrated there just as easily as I can sitting here at home. And so, you know, I have, in fact, I got right here next to me my bag of fluids that I got to hook up with my tubing. My other backpack, I got another one. I given the other one a break. I cleaned this one a while ago. And then my to-go pump. So now I'm on the go. I'm not stuck to a hole anymore. And now I can go. But seriously, you know, the IV hydration sends fluids and nutrients directly into my bloodstream, and they absorb faster and more effectively. Water and electrolytes are needed for the body to work properly. These substances help maintain the balance of the blood and other fluids present in tissues and cells. If your fluid or electrolytes levels fall way too low, you will need to replenish them. You can do this with oral solutions or intravenous solutions. Oral doesn't work. Not at all. It don't help me. It don't hurt me, but it doesn't help me. Oral hydration, because of the convenience and relatively safety in oral rehydration therapy is preferred in most cases of mild or moderate dehydration. Mild dehydration can be corrected by drinking approximately 23 ml of fluid for every pound of body weight over the course of 4 hours. The treatment of moderate dehydration for fluid replacement increases 46 ml of fluid for every pound of body weight. After 4 hours have passed, the patient can be reassessed and additional fluids may be given if necessary. Oral hydration does not require special equipment and is adequate for most cases. Intravenous rehydration. Replacement of fluids and electrolytes is generally used only in severe cases of dehydration. This route of administration requires sterile specialization equipment and should only be performed in a medical setting or by a trained professional. The main advantage of intravenous fluid replacement is that it works quickly with the fluids and electrolytes bypassing digestive tract and going directly into the bloodstream. Intravenous fluid replacement can also be used for patients whose vomiting makes drinking fluids difficult. Yeah, they don't give it to just any lame brain. But hey, what do I know? Yeah, I'm not that sick. And that is the difference between oral and IV that I keep trying to explain. The IV gets soaked up from your cells and it is redistributed to your bloodstream. And all of it that needs to go through the bloodstream goes through the bloodstream. That it doesn't go nowhere. It just sits in my stomach. And you know, and until you live with an ostomy and you don't have a colon, which that job is to suck up the fluids and vitamins and nutrients that your body needs, then and you have Crohn's disease and you have gastroparesis and then your stomach doesn't work, yeah, then come and tell me that I'm not sick and that I am playing a pity poor me. Okay, I can assure anybody I'm not playing a pity poor me card. I don't need it. I could care less. What I put out there is for anybody else out there. Maybe it might help them. Maybe it won't. Maybe they just enjoy the vlog. Who knows? What I know is this is what I go through. And I know there are plenty others out there that do the same thing. Some people, their doctor don't have them do 7 days a week. Because some of them are on TPNs. Some of them are on feeding tubes. It just depends on their situation. This is my situation. This is what my doctor has me on. I am also on IV medications. You know? Doctors don't put you on these sorts of things just for the fun of it. So, you know, dehydration is a big deal. You know, I sit at home in pain. I wake up in the middle of the night in pain. I jump in the bathtub with Epsom salt in pain. And a lot of times I fall asleep because it finally relieves the pain. But you know, I'm not on here bitching about it. I might say some things about it, but I don't sit here and bitch about it. You know, I don't do anything more or anything less than anybody else does. The only other thing that I do on my vlogs is I go to some current events. I go to some of the current events that affect me. And, you know, I'm sure there are people out there that could care less about my current events. And I'm sure there are people out there that might know more than I do about my current events. And I'm sure there are people out there that have no clue about one word that I'm saying about those current events. So, you know, I'm me. This is who I am. I am an open book. I've closed many chapters. I have plenty more chapters to write. And if you don't like me, I really don't care. If you want to follow me because you like my vlogs, you like where I stand on issues, hey, that's great, let's be friends. But, you know what? Anyway, yeah, I would be in the hospital a whole lot more had it not be for me doing IV hydration. And this is what I was trying to explain to my husband a year before last. Because taking oral hydration fluids in is different than IV. IV goes through my blood system. Oral, just once it passes through my stomach, goes right back out my bag. So, yeah, it's not worth it. So, I'd rather just do my IV, and I'm on the go now, so I can, you know, I can go at any time. I leave. You know, mine runs for 10 hours. I go to the grocery store. I go out to eat. I go to the movies. I take it everywhere. I also I also wear a Vogue mask, and it keeps me from getting sick from what everybody else has out there. So yeah, I got things going where I want them to now, and you know, and another way you can tell when you're getting dehydrated is nausea. I get so nauseated. And when I was in the hospital this month, in February, one thing that I asked for was IV fluids. I started vomiting in the hospital. That was my gastroparesis started flaring up even more. And so I got some more Finnegan. And I asked him, I said, hey, I know this is going to sound really weird. I said, but can you see if I can have my IV fluids, please? And I got him. And once I finally got caught up with my IV fluids, I started feeling better. The nausea got better. It's just like I always do. Like when I start, whenever I got time to eat, and after I ate, I'd get nauseous. Then the vancomycin made me sick to my stomach, so we got in a routine. 30 minutes before the vanc, we did Benadryl and Finnegan. If we didn't do the Benadryl, I was going to be the red man again. And so, yeah, you just learn those little tweaks. But, IV hydration is not for everybody. It's not, oh, I'm dehydrated, I need IV hydration. No, it's not for everybody. I do it every day because I have diseases that keep me dehydrated. It has my body so messed up that I stay dehydrated. It's not that I chose to be dehydrated. I'll sit here and I'll drink tea, I'll drink water, I'll drink Kool-Aid, and I stay dehydrated. I will drink a pop because it has sodium. Pop has a lot of sodium in it. And, when you're dehydrated, having some sodium is not bad because it retains the fluid and holds the fluid, so you're not pushing it right back out. But with me, it doesn't really matter. I still lose it. So, it's not a win-win for me. So, anyway, so I've been doing IV hydration for 4 years, I think. Yeah, 4 years. Hey, it's time for me to do my IV fluids. This one actually already has the water taken out of it. I think I'm going to go throw some clothes on and go to Dunkin' Donuts. This really is a very, very easy IV fluids. So, what I'm doing right here is I am programming it. Yeah, prime it a little bit. Right now I have air in my lines. I usually run it up to like 2 or 3. Okay, well, that's it. All hooked up for today. And this is what happens while I'm getting my fluids, while I'm just sitting here messing around. If you guys have any questions, comments, concerns, please leave them. If you cannot find anything nice to say, don't say it at all. But anyway, if there are anything you'd like to say, any questions, anything, please leave it and I will get back with you.